Okay, Bob, thank you. Well, after a year of debate, the health care reform awaits President Obama's signature.
One of the bill's supporters is Pennsylvania Congressman Joe Sestak, and he joins us live now from Old City, Philadelphia. Thank you so much, Congressman,
Good morning, Congressman,
for joining us.
Good morning, Liz and Yuki. Good to be with you.
Well, you have often talked about your daughter, who's a brain cancer survivor. I understand she was diagnosed with a malignant brain tumor, but she is a brain cancer survivor. And you wanted to make sure every American gets the same medical care that she received. How does this bill make that happen?
Well, what it means now is that my daughter, as anybody else who has a pre-existing condition, can now no longer be denied health care coverage when she reaches 18. Also, if, for example, you get diabetes or cancer, no longer is there an annual cap that the insurance company or a lifetime cap of treatment that they'll do above a certain amount, then no more. Also, if an insurance company finds out once you get cancer that you've made an administrative error when you applied for your policy 10 years ago, and all of a sudden you get cancer, they can by law deny you that. And so this is an effort not just to cover 32 million Americans, but for those who have health coverage today and lose their job, but have a pre-existing condition, and they go to another company, they can't be denied coverage. And it slows down the growth of health premiums by, for individuals, about 10 to 15% as we reduce the deficit $1.3 trillion. This is something that I feel all America will benefit from.
Congressman, opponents are saying that they are worried that they're going to have to pay more. What say you?
There's only one place you can go for decades where you have an objective, nonpartisan institution that says what this will cost or save, and that's the Congressional Budget Office. It is the one that said premiums would reduce for individuals 10 to 15%, and it is the one that said we will save deficit of $1.3 trillion. It's the same institute we used for the Bush tax cuts years ago, as well as this health care plan. Probably not perfect, but it's within the ballpark. Look, we know over the last 8 years health premiums have gone up 100%. In fact, this last year here in Philadelphia, many people went up 50 to 60%. Doing nothing was not an option, as 700 Pennsylvanians lost their health care yesterday. Once this bill's signed, no longer, if you have private health care, will you be losing it because the cost is skyrocketing. We're slowing it down. Do we need to do more, Liz? Oh, yes, we do. But at least it's a good major step.
And Congressman, Democrats obviously have been fighting for health care reform for, nearly half a century. So how big a victory is this?
This is a big victory for working families. Party, I don't care about that. What I really care about is the constituents who I serve as a public servant today are getting the same health coverage, Liz, that you mentioned I had in the U.S. military. In the U.S. military, we went off to war. And for 11 months I was at war, and I didn't worry about my daughter or my wife home. I was a healthy, productive warrior, and they were covered. Think about the great dividends that accrued to this nation because of that. Today, in the Philadelphia area and the 4 counties around it, 66% of the uninsured are working. And so therefore, across this nation, for the uninsured and underinsured, we lose $150 billion a year in productivity. Think of how much better we're going to be when we don't lose that, because people aren't sicker and staying out of work longer. This is good for America as well as individuals.
Congressman, we thank you for your insight and your passionate remarks. Thanks for joining us this morning.
Thank you so much.
Yuki, thank you. Thank you, Liz.